Hi everyone, my name is Brielle Stark. I'm an assistant professor at Indiana University in Bloomington, Indiana, and I'm just one of the parties who helped start this working group, which we have called FOQUSAphasia, which stands for Fostering Quality of Spoken Discourse in Aphasia. This is a very informal informational meeting. We'll be having our official meeting on January 22nd. But I thought I would record this for all the individuals who are located internationally who possibly can't tune in at the Eastern Standard Time that we've set it for, as well as anyone who can't attend in general. So just some background on FOQUSAphasia. Dr. Laura Murray, Manaswita Dutta, and myself pitched this idea as a roundtable last year at the Clinical Aphasiology Conference located in Whitefish, Montana. We had a lot of really interested parties, and we did a lot of reconnaissance to make sure that we weren't reinventing the wheel in terms of creating this type of working group. There are a lot of really great working groups out there in aphasia right now, such as Clinical Aphasia Trialists, the CATS group. So we didn't want to rework or redo anything that was already available. So what this came out of was a lot of chats regarding some inconsistencies in what was being reported in terms of spoken discourse, which was really leading to an inability to replicate a lot of studies and to perform meta-analyses to really move from the research spectra to the clinical arena. And so that's what this working group came out of. So the goal, if we had to summarize it in a sentence, is to improve the state of research/evidence in spoken discourse in aphasia. There is a lot of research out there on spoken discourse in aphasia. A huge amount of it started in the 70s and 80s, and it's continued on. Some great reviews by Lucy Bryant in 2016 and 17 demonstrate just how often spoken discourse is used in assessment and treatment of aphasia. And there's been special issues dedicated to spoken discourse throughout the years. I just cite some here in aphasiology. So there is no real issue with knowing that spoken discourse is important. We know that, but what we currently have is a real issue in terms of consistency and reporting of the data. So here are some that I'm going to highlight that we're hoping to tackle. Currently, no reporting standards exist, which lead us to some notable inconsistencies in the types of information being reported, difficulty in reproducing findings because of inconsistency or left out information, and an inability to conduct meta-analyses and to really form evidence-based conclusions across the research. We also know that psychometric properties of spoken discourse outcomes are relatively few and are also scattered across the research. Pritchard did a great review in 2017 discussing this, and she called for overall a focus on producing psychometric properties, but as of right now, they're relatively scattered across the research and the sample sizes are pretty small. So that brings me to my last point, which is that it's really difficult for one single place or a single study or a group to recruit a sample size that's big enough to address any of these issues. Aphasia is a group that is not necessarily huge. There are 2 million individuals living with aphasia in the US right now, but they're spread across the country. And it's really difficult to find these individuals, make sure they know about our studies. And for this reason, these sample sizes have been traditionally small in our research area. Unfortunately, that comes with a lot of power issues, amongst other things. So we need to really start banding together. And that's one of the reasons that this working group was formed, was to make sure that we can do that. We can bring together a similar protocol instituted at several different places and by nature get a larger sample size and be able to investigate our research questions. So just to summarize, right now, discourse actually was not recommended as a core outcome in a recently published core outcome set for aphasia, which was put out by Sarah Wallace in 2019 and her colleagues. And this is because it's had a lot of issues, all of which I've just highlighted here, which don't make it particularly compelling, especially the psychometric issues that I've just discussed. So that's why we are currently pushing this working group, why right now is the perfect time to do it. What our goal is to really interface with things that are already in existence and which are already well used by researchers and indeed clinicians in the field. So for instance, we're going to work alongside Aphasia Bank. If you are not familiar with Aphasia Bank, please look it up. It's aphasia.talkbank.org, I believe is the address. And it has a ton of behavioral data from individuals with aphasia as well as adults without brain damage doing a variety of language-based tasks. So what we're hoping to do is to make sure that our results, especially those that are investigating psychometric properties, are all available on Aphasia Bank so that everyone can go to this place and we don't keep creating new places for this information to be housed. We also want FOQUSAphasia to really just be a network, an international network preferably, of people who are willing to work together to create shared protocols, to create shared databases, and to answer questions that we all really care about. So we're going to start with improving the research evidence in a research setting, and then we want to move that to clinical settings. So really we need to work on what we're doing in the research first before we can push for it to be implemented in the clinical setting. And this is fairly typical in how things progress. I'd like to now go over what the working group structure is going to look like. We pulled this from a few different places, but one of what I find is a very interesting and well-designed group here in the US is called ACRM, and it is a big network of rehab professionals. And what they do is they essentially create task forces which investigate questions of interest. So for us, we are going to be made up of a steering committee which rotates, some task forces which are led by leadership teams, which are full of members, and then some stakeholders who we will define as being people with aphasia, as well as their care providers and interested parties. So this is what we propose for a working group to really look like. It's meant to be a relatively level or flat design. It's not supposed to be hierarchical in nature. So as a member, you would join a task force or task forces. So you want to join something of interest for you, and then you dictate your role in that team. So if you, let's say, want to join our best practices task force over here on the left, which I'll talk a little bit more about in a second, you would just join, you would write an email, or I believe we're going to do a Google group to join FOQUSAphasia in general, and then you just specify that your task force of interest is best practices. So what that does is it puts you into that members at large area on the left. What we're going to do then is have people nominate themselves or others to become part of the small leadership team, who will then just direct the initiative progress, make sure everyone's on time, do a little bit of mediation. You know, they can discuss authorship, they can discuss protocol creation, and really just help guide all of the interested parties. So that's how joining FOQUSAphasia will work. All of the members in general will come together to nominate and then vote on a steering committee. The goal of the steering committee is to interface with those stakeholders and to really just serve as a sounding board for the task forces, making sure everything is grounded in the evidence, grounded in quality questions, and just to really direct FOQUSAphasia. And we want that steering committee to rotate across time. So we haven't decided how long they'll serve just yet, but we're thinking probably a year or 2 years would be the commitment there. I do want to point out we've written a preprint that's loaded on SciRx, which you can see there's a little link on the bottom right here. This paper has been accepted by the American Journal of Speech Language Pathology, AJSLP, which will be coming out as the Clinical Aphasiology Conference special issue later this spring, so spring 2020. Look out for that, or go ahead and check out the preprint. The only difference with the preprint is it's not beautifully laid out as it will be in AJSLP in the spring. So what we've decided to do just to launch FOQUSAphasia is to only start with 2 task forces right now. Within each task force are things called initiatives, which you can really think of as just being projects. So in the future, the number of task forces can grow, the number of initiatives within a task force can grow. But right now we wanted to just start with 2 task forces, which each have 1 initiative, and to really address some tangible and answerable questions. These are the 2 task forces that we decided on. First ones we call best practices, and the initiative is to create some reporting standards. So to make sure that we are reporting exactly what we need to be reporting to make sure our discourse studies are reproducible and can be used in meta-analyses, that we're reporting the results that we need in order to verify and to make these assumptions across evidence. The second task force that we created is called methodology and data quality. And within that, the initiative is called test retest database creation. So we're really looking at outcome measure stability within spoken discourse. This is something that's been heavily looked at by Mary Boyle, for example, who does a great job of really pushing for looking at outcome stability. She just put out a recent 2020 paper in Seminars for Speech Language, which I highly recommend you look at. But we need to increase our sample size with test retest, and we want to make this database of psychometric properties and possibly normative data available for free on Aphasia Bank. So that's what we're really pushing for in this second task force. That first task force, best practices, this was a timeline that we pushed out in the paper where we will start creating reporting standards. We actually conducted a survey trying to replicate some prior surveys done by Lucy Bryant and Madeline Pritchard. And then right now we are actively looking at results for that. And we are looking to push out those results probably in early summer 2020, and then start creating a living document for reporting standards that will live on Aphasia Bank as well as on our FOQUSAphasia website. You can think of this living document as being something similar to the Equator Network, which gives really great advice to those who are published in clinical trials. If you're interested in neuroscience, as I am, there is a great living document called COBITUS, which is put out by the Organization for Human Brain Mapping, which is a set of reporting standards to make sure that neuroscience is replicable as well. That's what we're going for. If you're interested in participating, this would be the task force to join. Oh, I just summarized that, but just in case you wanted to see it in writing, fingers crossed, we'll be getting out this paper relatively soon. We're going to grab some more authors to look at some qualitative data, but currently it's spread across Davida Fromm, who's also from Aphasia Bank, Laura Murray, Manaswita Dutta, Lucy Bryant, and myself. And fingers crossed you'll be seeing us present these results at several conferences in 2020. The second task force is this methodology and data quality, or MDQ task force, where we're trying to create that test retest database. This is a proposed timeline for this. You'll see it's much longer than the one I just showed you from the best practices. And that's because we really want this to be a multi-site data collection that is eventually aggregated and hosted on Aphasia Bank. So it's going to take a lot of interested parties who come together to create a shared protocol and work on high fidelity across sites for data collection, analysis, and then reporting. I did just get a new investigator award from the American Speech Language Hearing Foundation that will allow us to collect some pilot data for this. We're planning on a really short test-retest interval, which allows us to look at the actual stability of the outcome measure itself rather than anything else that could be going on. I'm going to be restricting this largely to chronic aphasia, but various etiologies, so including stroke as well as traumatic brain injury. But the goal is to really evaluate how best to train our data collectors, our raters, our students who are working on this, make sure that there's high fidelity across these individuals collecting data, work on inter and intra-rater reliability of transcription and coding, and create a good working document on which the task force can really use going forward to create their protocol. and to just look at some preliminary results for how reliable these outcome measures really are. And again, the goal is to interface with the Aphasia Bank, so we're going to upload this pilot data there as soon as we can, and hopefully those people interested in this task force will be able to use it and see some of the documents that we created from it, tweak it, make it better, and then go forward with creating our big test-retest database. So some short and long-term goals, just to sort of wrap up here. A major short-term goal, and it will translate really well long-term, is to just get the word out about FOQUSAphasia. Spread it at conferences, Twitter, in manuscripts and letters to the editor that you write, in your blog posts. If we could all hashtag FOQUSAphasia in social media, that would be fantastic as well. But we really need to get the word out to all of our colleagues who might be interested and who could serve as great data collection or analysis sites. A next step will be to elect some leadership teams for each task force. You'll see some directions listed on here, but if you could email me, I'll add you to the Google group, and then I'll get in touch regarding nominations and voting. Some long-term goals that we have is just continued international cross-cultural collaboration. We want to collect data not only in the English language, not only from individuals in big cities. We want to make sure that we are getting data from rural places, from people who are bilingual or multilingual, from people whose first language is not English as well. And we need people on each task force to push for those and who are able to collect that data. We want to interface with related working groups. CATS, I'm listing there. I believe I said clinical instead of collaboration earlier, so I apologize. It's collaboration of aphasia trialists. If you're not a member, I highly recommend looking into it. It's free to be a member, and like this group, you can kind of choose your level of participation. They have really interesting initiatives right now too, a little different because they're currently focusing not on spoken discourse necessarily, but they've done some really interesting stuff like improving or rather translating and interpreting the CAT, the Comprehensive Aphasia Test, to different languages, which is a very, very awesome endeavor that they've done. And then really long-term goal, but one I'd love to see, is a virtual conference for aphasia research with a day to highlight discourse. Miranda Rose, I think Linda Worrell, and Julius Fredrickson and I have chatted about this on Twitter, and it would be just fantastic to have a little group of people come together to figure out how to make this virtual conference a thing. If you don't know, CSTAR, which is the Center for the Study of Aphasia Recovery, has an online lecture series that hosts a ton of awesome aphasia lectures, and they're doing right now a little mini series on curing aphasia, and I believe Linda Worrell just gave a great talk on the social cure, and Julius Fredrickson is doing one this spring on the neuroscience cure, and that is to kick off this idea of getting people interested in a virtual conference and an international attendance. So check those out. They're on YouTube, and you can tune in live as well. In general, being a member, I've talked a little bit about this, but it is very much so that we exist as a working group to be your foundation for networking, your foundation for resources and expertise. Hopefully in the future, we'll be able to self-fund ourselves, but each member chooses the extent to which they want to be involved. And that depends, of course, on the resources you have, your place in academia. You know, if you're a student, if you're a postdoc, if you're an early career, if you're an established investigator, it depends on what you want to do and what your research program is. So you choose your level of contribution to any of the task forces, to both of them, to creating a new one in the future, etc. So we're not going to be, again, hierarchical in any way. We want to be a working group that really just functions as a foundation. I will be starting a Google group to connect us all. This may evolve in the future, but for now, as we grow and develop, it'll be a place where we can just have discussions online, post resources, ask questions, be a proponent of our own research. So if you're interested, send me an email, bcstark@iu.edu. I believe I have a slide with my email on it. I've had a lot of interested people email me already, which is fantastic, but please send me an email and I'll add you to that Google group as soon as I can. We're going to do a little live intro, so we won't obviously do this. I want to leave you with some contacts. If you know any of us or would like to get to know any of us, here are some contacts who are actively involved at the moment. Davita from Aphasia Bank is also very active. Manaswita Dutta, who's just finishing up her PhD, also very active. We've got fantastic members who just helped us publish that paper in AJSLP, who are spread out all around the US and abroad. So just keep an eye out. Send me an email if you would like to join or if you have any questions at all. You'll see the web address listed down below for our working group, which is FOQUSAphasia.com. Here is the preprint in case you wanted to look it up or Google it. Again, it should be coming out in the spring in AJSLP. Thanks for tuning in.